So much has been talked about this meeting promised by the French language minister Jean-François Roberge over those new OQLF directives issued about a week or so ago, the ones that made us all wonder, since when did we have to worry about being able to have, English access in our healthcare facilities and social service settings? Well, we spoke at the time. I had Jean-François Roberge on the show who said, based on that reaction, don't worry, I'm going to meet with Anglo groups. We'll get this thing straight. That we'll clarify. I think that was his word. We'll clarify these directives. Of course, at the same time, he also opted out of getting too involved by saying, well, I'm the language minister. I'm not the health minister, and these affect the healthcare system, which is odd when you consider that he's the only one who was ready to show up at these meetings. There was no health minister. There was no minister for relations with Anglos at this meeting either. The Quebec Community Groups Network, we assumed, would be invited to this meeting since they have spoken up on multiple occasions concerning Anglo rights here. But I don't think that's how this played out. At least that's not my understanding. Sylvia Martin-Laforge is Director General of the Quebec Community Groups Network, and she's on the line. Sylvia, thanks for being here. Can we begin with that clarification? Were you or were you not invited to this meeting by the minister?
So we were not invited to the meeting that was called last Friday to happen today. We were emailed this morning to meet with the minister later this afternoon. So it was another meeting. And we clarified with the minister's office, Minister Roberge's office, that in fact the Minister of Health would be there. And they said no. And we said, well, we have always wanted, and we wrote a letter in late July when this all started, to meet with the Minister of Health since it's a health issue. So thank you, but we will not be at this other meeting.
So it was a thank you, but no thank you.
That's right.
And no response from the government with respect to Christian Dubé, just simply, he's not going to be there. Sorry, you can come if you want to, but otherwise, that's fine.
So, yes,
okay.
We're still waiting for an answer from Minister Dubé. We have an acknowledgement, but we have no meeting. Apparently, he's away. And as I said, we were not at the meeting today, which I think happened around 11 o'clock.
So I will tell you, you've seen the reaction, obviously, from the minister who wrote afterwards. I'll just read this. The translation is, we had the opportunity to hear the concerns of different groups today during a meeting that was very cordial. That's his word. We will produce new documents so that the government's initial intentions are well understood and that the rights of all are always and again reaffirmed. And then he thanks Christian Dubé and Eric Girard. Your reaction to that?
Well, we believe that the directives should be scrapped, not made quote unquote clearer, because there should be, administrative French language should not be in the delivery of health and social services. At the very least, if he does what he says he will do, if the directives are to be edited, the directives we have today should be suspended. How long do we have to go with these directives until the others come out? And what consultation process will he be using to edit, I use his words, or the translated words, to the other directives? So as of today, those directives should be suspended.
Do you, I'm not sure if this is a fair question to ask or not, especially given the fact that at the last minute you were asked. Do you take this, the fact that you were not asked initially after the minister promised to meet with Anglo rights groups, that you were not asked to be part of this?
Well, the question that's asked is answered at the same time. Who knows? We have challenged the government. The QCGen has challenged the government on every aspect of Bill 96 since for the last 2.5 years, every aspect, including health and social services. But the government has been so adamant over the years to say, don't worry, don't worry. Nothing will happen to health and social services. I guess some of us believed thought we should be believing them, but we must not. We must not. These directives are ridiculous, coercive, and have to be scrapped, or at the very least redone.
When I asked the minister last week when he was on the show about this part where it said English eligibility certificates, according to the directives, right, the OQLF ones, would be necessary, would be needed, his answer to me, and I asked him point blank, Sylvia, will you need to show these? He said no. And then he pointed out that no, the way it's written now, this only applies to the administration within these hospitals. Do you believe that, or from what you've read, did you see that mentioned anywhere?
So, Aaron, you're smart. I'm smart. There's a lot of smart people out there. We don't believe it. There's no way we can believe this. They have been talking. This government has been talking about eligibility certificates since 2019. That's the first time I heard about eligibility certificates being used for something else than the youth sector. And at the time, Simon-Jolin Barrette, the minister, said, no, it was misspeak. It's not misspeak. When they say something, they mean it. And we should be very worried about the use of eligibility certificates under the Education Act, and the Constitution, Section 23 of the Constitution, in anything else except education.
What's your advice? And I want to get to Eric Maldoff in a sec. What's your advice now to Anglos? You know, when we bring this idea up of their meeting with the Anglo community, and of course the question is, well, who is the Anglo community? What should individual citizens who hear you now, what would be your advice to them in terms of dealing with the government and letting the government know what?
We must let the government know that this is abhorrent to us. The use of these directives is abhorrent to us. And we must write about it. We must complain about it. Unfortunately, we have no mechanism, currently at least, to complain, to a central agency. And maybe we all have to think about that. How, in fact, would we all come together to work against, to protest what the government is doing? I think, frankly, that in the last couple of weeks, the ministers have come to realize how serious we are, and we're hearing about it from the Toronto Star, from the Globe and Mail, outside of Quebec. And so we just have to keep working to make our voices heard.
Sylvia Martin-Laforge, Director General of the Quebec Community Groups Network. Sylvia, thanks so much for the time. Going to go to Eric Maldoff, who I believe is online. Eric, are you there? Can you hear me?
I can.
There we go. Okay. So I texted you earlier in the afternoon saying I'd like your reaction. And we found out because, the big sort of, and I don't want to call it that way, but let's refer to this as the big joke was we had no idea who Jean-François Roberge was going to be meeting with. You just heard Sylvia over at, the QCGN saying they weren't asked. So now we're finding out, and I know you know the list now, Grand Montreal, the Jeffrey Hale Hospital. Do you know who these people are?
I don't know exactly who attended. We've heard of some organizations now that have been and were invited and I assume attended, but we don't know exactly the individuals who were there. It is quite remarkable, Aaron, that something of this important to the health and well-being of over 1 million Quebecers would be run as some sort of a secret process that nobody even knew was really taking place, except that the government said they were going to meet. Didn't know what time, didn't know what place, didn't know who. The government is yet to announce who was at the meeting. So who is ostensibly representing the community, and what experience and knowledge do they bring to that table? This is an unbelievable thing. And we're talking about health. This is not national security here. This is not an invasion. This is about people getting access to health care, and it's being run as a secret process with anonymous informants.
It's interesting. I'm just looking at the list now. They have the Cumming Center on the list as well, and they have a group called Senior Action Quebec on the list. Obviously, the Cumming Center we know. You familiar with anyone at Senior Action Quebec?
Currently, I don't know who is actually running that.
Okay.
The issue there is, yes, it's an organization that does some good work. It's dealing with seniors. It's a lobby for them, and more power to them. But we're talking about the mainstream of the health and social service network, and they're sort of cherry picking, I guess, whoever would accept to come.
Yeah, or perhaps they're cherry picking who up until now has not complained too longly or loudly about some of the actions that they've taken. Maybe that's it. You heard Sylvia say, you know what, they've been a thorn in the side of the Quebec government since the get-go. Maybe that's why they don't get an invite.
Well, I'm sure that from the behavior we've seen, this government has avoided, like the plague, having to deal with the issues. So they finally have been forced into it because the case has been made in so many different ways of how repugnant and unacceptable this directive is. And now federal members of parliament are coming out, and the federal minister of health has come out. And people are saying the power to decide the language in which health and social services is delivered, that's a power that belongs to the client, the patient, the user. It's not the provider who gets to make that decision. Yeah. The provider's only decision to make is how best to ensure effective communication so that they can deliver safe and effective care. And that's all for the patient.
I would ask you just as a final question, because I have to wrap up here. Based on what you read or based on what you heard today, and I read that tweet, the translated tweet from the minister, are you hopeful that something changes here, or is this just more smoke and mirrors about, well, we're going to rewrite some of the directives?
I agree with what's been said. Number one, this is a health dossier, and Minister Dubé had better step up to the plate and defend his system. He's been hiding all along, probably because he feels very uncomfortable with this. The Minister Roberge, the Minister of Language, is neither knowledgeable about health and social service delivery nor about law, from what I can see, and really is not the person who can deal with this. This is an on-the-ground, real live issue affecting human lives and well-being. And it's time that the real people come to the table and sit down and try to resolve this. Frankly, with the government saying that anybody who wants service in English will get it, then they might as well scrap this whole directive. Why do we need 35 pages of that for?
Eric Maldoff, Montreal lawyer, chair of the Coalition for Quality Health and Social Services. Eric, appreciate it as always. Thank you.
Thank you for having me.
You bet.
Bye.
Take care.